Hello, my name is Annette Bettis, and I am here to present an article research study titled Post Traumatic Stress Disorder, PTSD, Multicultural Issues and Mental Health. In some cultures, mental health problems are seen as a sign of weakness, and people may be reluctant to seek help for fear of stigma or discrimination. Post traumatic stress disorder is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. More viruses have appeared in the last 50 years that have affected different regions and multiple countries, but one of the most widespread worldwide is COVID 19. Early December 2019, the new coronavirus was identified and named COVID 19. February 18th, 2020, 57,805 individuals were infected with the COVID 19. The concept of culture, its definition, and its developmental socialization process are presented as foundations for understanding the many influences of culture, variables on the perception, experience, clinical expressions, and treatment responses to trauma. The focus here is to look into the multicultural disability issues of PTSD that have arisen since the COVID 19 pandemic, with mental health issues at an all high, looking through the lens of how multicultural matters can be a factor is vital to the research. To begin this research, the question many are asking, and the target question for this research is: how has the COVID 19 pandemic affected individuals with PTSD? Reflecting on this question brings the purpose to a more prominent meaning. That purpose is to have a clearer understanding of how to support individuals with PTSD and mental health issues stemming from the COVID 19 pandemic. In closing, the outcome is to prove the accuracy of the thesis in this study. The thesis study states, while some people think the mental health effects of the COVID 19 pandemic are an excuse not to return to the reality of life, the multicultural trauma of the COVID 19 pandemic has caused true PTSD in many individuals. Let us begin the research by showing this figure. It displays 6 countries and the number of reported COVID 19 cases during waves 1 and 2. As you can see by the second graph, wave 2 had significantly higher numbers reported during this time. Furthermore, the third graph shows the daily deaths grew very rapidly. This virus sparked a global pandemic that has killed nearly 7 million people and counting, and has presented itself as a global pandemic in a short period, resulting in a rapid curve shift of infected patients, increasing death rates, a vast global economic burden, and widespread mobilization of medical resources across the globe. Each of the 5 articles used for this study had different methods to produce data. They are as follows. Study 1, titled PTSD in the COVID 19 Era, is a study of a deep, comprehensive review of the relevant literature regarding the pandemic and its debilitating consequences on the psychological status of the public. Study 2, titled PTSD Treatment in Time of COVID 19, a systematic review of the effects of online EMDR, eye movement desensitization and reprocessing. Study 3, Post Traumatic Stress Disorder, a differentiational diagnostic consideration for COVID 19 survivors. This one focused on several areas of literature, and that was psychiatric, neurological, neuropathological of outcomes of SARS and MERS patients. Study 4, titled Exposure to COVID 19 during the first and second wave of the pandemic and coronavirus related PTSD, risking among university students from 6 countries. This was a cross sectional study conducted in 6 countries. Study 5, titled Risk Factors for Depression, Anxiety, and PTSD Symptoms in Perinatal Women During the COVID 19 Pandemic. They assessed COVID 19 related health worries and grief and current mental health symptoms through a cross sectional study design. All studies show different multicultural dynamics for this purpose. This figure displays a visual of the implications of the COVID 19 pandemic and how it had on individuals nationwide. Social and economic stressors were fear of getting ill, fear of infecting others, shortage of food, shortage of financial resources, scientific uncertainty about the virus, social stigmas, and other social and economic stressors. Other psychological effects included acute stress disorder, irritability, insomnia, emotional distress, mood disorders, impact on the mental and psychological health of health care workers, impact on pregnant women, fear and panic, frustration, boredom, poor communication. All these implications were affected due to closures of schools, businesses, and other work related that were not essential businesses. After reading all articles intended for this research, the results are as followed. Study 1 shows that the review illustrates pandemic had a traumatic impact on the psychological functioning of the public, particularly COVID 19 survivors, older adults, and healthcare workers due to difficulties in coping with new realities and uncertainties. Study 2 resulted in heightened risk of PTSD occurred in MERS and SARS survivors. While data concerning COVID 19 is lacking, PTSD is known to occur in patient groups who undergo similar hospital courses, including ICU survivors, patients who are incubated and mechanically ventilated, and those who experience delirium. Study 3 resulted in systematic review, identified only one trial of examining the effects of online EMDR for PTSD in children and adults. Specifically, this study was limited by a lack of a control group. As a result, it cannot be ruled out that the improvements were due to natural recoveries. Study 4 students exposed to the COVID 19 pandemic in terms of losing a job and worsening economic statuses were 1.6 times and 1.8 times more likely to be in a very high coronavirus related PTSD risk group. Among demographic factors, female gender, and previous diagnosis of depression and PTSD were associated with a twofold higher risk of COVID 19 related PTSD. Study 5 Among the respondents, 36.4% reported clinically significant levels of depression, 22.7% for generalized anxiety, and 10.3% for PTSD. Women with pre existing mental health diagnoses based on their self reported history were 1.6 to 3.7 more likely to score at clinically significant levels of depression, generalized anxiety, and PTSD. Approximately 18% reported high levels of COVID 19 related health worries and were more likely to score above the clinical threshold for mental health symptoms. Approximately 9% reported high levels of grief and were 4.8 to 5.5 times more likely to score above the clinical threshold for mental health symptoms. These results show different aspects of multiculturalism from gender, race, age, community, and career differences. Continuing with results, this table shows college age students just how high the numbers were as individuals were affected with the PTSD during the COVID 19. As shown, PTSD at risk students were at 78.20% higher than those at no risk of 21.80%. Those at a very high risk were only 23.10% with PTSD, and those at no risk were much higher at 76.90%. In closing, a pandemic may leave behind more significant and long lasting damage to mental health than to the economy. This has been evident in the increasing cases of PTSD, where several studies conducted during the pandemic have reported high numbers of people diagnosed with PTSD trauma. Research shows that 6 out of every 100 people will experience PTSD at some point in their life. So we ask if the research question was answered, and the answer was yes. Below are the 5 main effects on individuals with PTSD due to the COVID 19 pandemic. 1. Feeling more on guard or unsafe. 2. More trauma triggers. 3. Not doing things that are still considered safe. 4. An increase in negative thoughts and feelings. And 5. Problems with sleep and concentration. Although it was a complete country lockdown, the economy is still progressing. However, the pandemic left behind more significant and long lasting damage to the mental health world. Overall, this study had limitations, including the relatively small sample sizes through different research, as PTSD symptoms rates may vary over time. Implications such as more counseling are warranted, meeting individuals at their level of needs. In order to continue the outstanding research already before us, future research should focus on larger scale research to have a more accurate look at the effects of PTSD nationwide. More country comparisons would help determine which areas need more mental health support and counseling. Therefore, identifying the multicultural issues that lie within the COVID 19 pandemic. Thank you for taking the time to learn more about mental health issues such as PTSD through the times of the COVID 19 pandemic. Listed are the references for this research study.